Okay, let's dive into this.
Question 41. Which of the following should be administered to control perioperative bleeding in a patient with chronic renal failure? Options: A. Platelets, B. Ringer lactate, C. Fresh frozen plasma, D. Factor VII concentrates, E. Desmopressin. The correct choice is option E, desmopressin.
Detailed reason? Uremia causes qualitative platelet dysfunction. Desmopressin improves platelet adhesion and function. Exam pearls: uremia causes platelet dysfunction. Bleeding time is prolonged. First-line therapy is desmopressin, or DDAVP. Dialysis reduces bleeding tendency. Cryoprecipitate may be used if DDAVP fails.
Question 42. A postoperative patient has an INR of 1.6, an APTT of 32 seconds, which is normal, and platelets at 270,000 per microliter. Probable diagnosis. Options: A. Heparin overdose, B. Vitamin K deficiency, C. Von Willebrand disease, D. Hemophilia, E. DIC. Option B, vitamin K deficiency, is your answer.
Detailed reason: vitamin K deficiency causes a deficiency of factors 2, 7, 9, and 10, prolonging PT and INR while APTT remains normal initially. Exam pearls: vitamin K deficiency leads to prolonged PT first. Factor 7 is affected earliest. INR is elevated. Platelet count remains normal. APTT may remain normal initially.
Question 43. How are the effects of warfarin reversed in emergency settings? Options: A. Vitamin K administration, B. Fresh frozen plasma, C. Whole blood, D. Cryoprecipitate, E. Platelet concentrates. Option B, fresh frozen plasma, is correct. Detailed reason: FFP provides immediate replacement of vitamin K-dependent clotting factors, preferred in emergencies or active bleeding. Exam pearls: warfarin inhibits factors 2, 7, 9, and X. FFP acts immediately. Vitamin K takes 6 to 24 hours. PCC is another rapid reversal option. Use FFP for emergency surgery or active bleeding. Question 44. A male infant develops prolonged bleeding after umbilical cord separation. 2 elder brothers had similar complaints. Which factor is deficient? Options: A. Von Willebrand factor, B. Factor 5, C. Factor 8, D. Factor 10, E. Defective GPIB/3A receptors. Option C, Factor 8, is the right answer. Detailed reason: the X-linked inheritance pattern and prolonged bleeding are typical of hemophilia A caused by Factor 8 deficiency. Exam pearls: hemophilia A equals Factor 8 deficiency, X-linked recessive inheritance. Hemarthrosis is characteristic, APTT is prolonged. Bleeding after circumcision or cord separation is common. Question 45. A patient with severe hemophilia A undergoes elective surgery. Best option for prevention or treatment of bleeding. Options: A. Fresh frozen plasma, B. Desmopressin plus FFP, C. DDAVP, D. Aminocaproic acid plus desmopressin, E. Factor X concentrate. The answer here is option D, aminocaproic acid plus desmopressin. Detailed reason: severe hemophilia A requires aggressive support. Desmopressin increases Factor 8 and VWF levels. Aminocaproic acid prevents clot breakdown. Exam pearls: hemophilia A equals Factor 8 deficiency. Mild disease, DDAVP may be sufficient. Severe disease, DDAVP plus antifibrinolytic therapy. Best replacement is Factor 8 concentrate. Cryoprecipitate contains Factor 8 and VWF. Question 46. A 20-year-old adolescent boy with a history of hemophilia A is undergoing elective surgery. Best option for preventing or treating bleeding. Options: A. Fresh frozen plasma, B. Packed red cells, C. Whole blood, D. Cryoprecipitate, E. Factor 9 concentrate. Option D, cryoprecipitate, is correct. Detailed reason: ideal treatment is Factor 8 concentrate, but cryoprecipitate is the best listed choice containing Factor 8, VWF, fibrinogen, fibronectin, and Factor 13. Exam pearls: hemophilia A equals Factor 8 deficiency. Best treatment is Factor 8 concentrate. DDAVP increases Factor 8 and VWF. Cryoprecipitate contains Factor 8 plus VWF plus fibrinogen plus Factor 13. Factor I9 concentrate is used for hemophilia B. Question 47. A 15-year-old child develops pain and swelling of the left knee, along with persistent bleeding after a minor injury. His APTT is prolonged. Best treatment. Options:
A. Cryoprecipitate, B. FFP, C. Platelet transfusion, D. Tranexamic acid, E. Whole blood. Option A. Cryoprecipitate is your answer.
Detailed reason: painful swollen knee, or hemarthrosis, with prolonged APTT characterizes hemophilia A. Cryoprecipitate provides factor VIII replacement. Exam pearls: hemarthrosis is a classic feature of hemophilia A. APTT is prolonged, PT and platelet count are usually normal. Best product is factor VIII concentrate. Cryoprecipitate is an alternative. FFP contains insufficient factor VIII.
Question 48. All of the following can be administered in DIC except options: A. Heparin, B. Protamine sulfate, C. Fresh frozen plasma, D. Cryoprecipitate, E. Platelets. Option B. Protamine sulfate is the exception.
Detailed reason: protamine sulfate is the antidote for heparin overdose and has absolutely no role in treating DIC. Exam pearls: DIC equals consumption of platelets and clotting factors. FFP replaces multiple clotting factors. Cryoprecipitate replenishes fibrinogen. Platelets are given for significant thrombocytopenia. Heparin may be considered in selected chronic DIC cases. Question 49. Which of the following should be administered preoperatively in a patient with von Willebrand disease undergoing elective surgery? Options: A. Factor VIII concentrates, B. Low molecular weight dextrin, C. Fresh frozen plasma, D. Cryoprecipitate, E. Whole blood. Option D. Cryoprecipitate is correct.
Detailed reason: VWD causes defective platelet adhesion and reduced factor VIII stability. Cryoprecipitate supplies both VWF and factor VIII. Exam pearls: VWF mediates platelet adhesion to damaged endothelium. VWF stabilizes factor VIII. Bleeding time is elevated and APTT is elevated. Cryoprecipitate contains VWF plus factor VIII. DDAVP stimulates the release of VWF from endothelial cells. Question 50. A 20-year-old woman has an APTT of 78 seconds, which is elevated. A PT of 13 seconds, normal. Platelet count of 350,000 per cubic millimeter, normal. And an abnormal bleeding time. Most likely diagnosis? Options: A. Hemophilia A, B. Hemophilia B, C. Von Willebrand disease, D. DIC, E. Factor V Leiden. The diagnosis is option C. Von Willebrand disease. Detailed reason: VVD causes defective platelet adhesion, meaning a prolonged bleeding time, and reduced factor VIII stability, meaning a prolonged APTT. PT and platelets are normal. Exam pearls: it's the most common inherited bleeding disorder, usually autosomal dominant. Bleeding time is elevated, APT is elevated, PT is normal. Presents with epistaxis, menorrhagia, mucosal bleeding. Ristocetin cofactor assay is reduced. If you encountered these lab values on your boards tomorrow, would you make the catch?